There are 33 million people living with HIV worldwide. The majority of them do not know they are positive. How can we possibly stop AIDS if we don't change that? We need to think bigger. We need to be testing 1 billion people for HIV. And so AIDS Healthcare Foundation started that process by launching the Testing Millions campaign. The system by which people were being tested was so antiquated that we knew that we couldn't do it that way. They were taking a half hour for each person. And if we need to do 1 billion tests, that's a 500 million staff hours. That's not practical.
The testing methods have changed where you get the quick tests where within a minute one is able to get the results. We have seen a revolution where there is mass testing and you can have in one day thousands of people testing.
We knew it would be a big job to coordinate testing all over the world in Eastern Europe, in Latin America, Asia, Africa, and the United States. But we just decided to dive into it and confront those challenges, and as a result we had the big success around World AIDS Day. India is a big concern. It has the second largest number of positive people in the world, yet testing is very difficult for the average person to access. So we knew that our task was to change that model. When I see women lined up in saris in India, waiting to be tested, it tells me that the people are ahead of the policymakers. People want to be tested.
We have seen in Uganda now services for testing being taken to where the people are, in marketplaces, at bus stops, at railway stations, and those people then are able to have the testing done on site. I think it's very important to have mass testing initiatives in collaboration with an institution like AIDS Healthcare Foundation.
We're normalizing it. We're helping to reduce the stigma. We're saying it's not such a hush-hush thing. You get screened for other diseases. This is something you need to do. Get it done quickly. No muss, no fuss. And if you are positive, you will have immediate access to treatment. We couldn't have done this testing campaign 10 years ago because there was no treatment available. When people line up in the hot sun for hours to get a test, obviously they're not afraid for people to see that they want an HIV test. The majority of people who are HIV positive in the world do not know it. The real challenge, if you want to stop this disease, is to find the people who are positive and break the chain of infection and get them into care. Live demonstrations really pack a wallop. And I think that the Test Millions campaign has been a gigantic worldwide demonstration of what we need. The magic ingredient is hope. People know that there's hope, and therefore, if they're positive, they know that they can get treated and they can live a relatively normal life.
Eastern Europe is facing critical phase of HIV/AIDS epidemic because it is the fastest growing epidemic in the world. But what makes the epidemic unique is really the speed. For example, in the last 7 years, the number of people officially registered in the region grow more than 65%. And this really makes epidemic in the region unique and really in crisis. The Testing Million event in Tallinn was truly revolutionary. Everybody who wants to get free and easy HIV test and learn their HIV status. People stood in the wind and freezing rain for more than an hour to get a free rapid HIV test. And they got their results in a minute. It was really a celebration of free spirit and united efforts in this Baltic nation.
I was on a panel a few years ago with the editor of Lancet, and he was protesting our ideas on testing and saying that they were a violation of human rights. And I turned to him and I said, are you suggesting that we protect people's rights by sacrificing their lives?
HIV is still a big issue in Latin America, and a lot of the people, they still don't know their HIV status because most of the people are never been tested. For example, in the case of Mexico, The official figures of people living with HIV are 220,000, but the number of people that are receiving treatment are just 50,000. So what is wrong with 150,000? The answer is they've never been tested.
We do lots of screening for other diseases that are life-threatening. HIV should be no different. People are either finding out that they're positive and they can get treated, they can live, or they're finding out that they're negative and they have an opportunity to stay negative. Getting tested and taking care of yourself is life-affirming. We need a worldwide mobilization that increases the number of people being tested tenfold. And once we've done that, that's really going to help break the chain of infection. I know that we have it within our power, our ability to control AIDS in the world today. The question is, do we have the will?